Hey everyone, welcome back to another video. In today's video, I'm going to do a subscriber special, a Q&A. I asked on my Instagram if you guys have any questions for me and I will answer them, and I've got a few responses. But first, I really want to thank each and every single one of you who has subscribed to my channel. It was last year around March when I hit my 1,000 subscriber mark. And now that we're in April 30th, May 1st, I've hit 5,100. So I'm really grateful that you guys have liked the content I've uploaded, and I appreciate your guys' support so much. When I created this channel, I didn't think many people would want to see some of these videos that I've created, but you know, when I was a nursing student or when I was a nurse, I always was eager to learn more about different nursing options, different careers in nursing, and different specialties, just because I thought I wanted to know what are my options as a nurse. And so that's what I aim to do in this channel, is to provide more educational content and try and teach people as much as I know. Because, you know, one thing that's great about nursing, I'm sure most of you know, is that, you know, no one can be a master of nursing. You know, there's so much to know and so much to learn, and every single day when I go to work, I learn so much from people that just simply are more knowledgeable than me and have a lot more experience. So thankfully, my work is continuing to educate and teach me, and I can utilize that knowledge I gained from both clinical and theory and share it with you guys in this channel. So I'm super grateful that you guys have chosen to subscribe and like this video and like my videos. So I'll go straight into today's video. I got a bunch of questions on my Instagram and some from my different comments on my different YouTube videos, and then I also got some emails that were questions, and I wanted to answer some of them. So let's get started with those. So a very common question I get asked is, what unit should I start as a new grad nurse? And I think that's really an individual question. What I mean by that is, you have to really assess your ability to work in that environment. You know, the whole purpose of nursing school and, you know, clinical is to prepare you for patient interactions. Now, when you work at the hospital, you work bedside and you work with sick people, and these sick people have possibly events that occur. That's why they're at the hospital. You know, they could have a myocardial infarction, they could have a stroke. So, you know, you got to ask yourself what your confidence level is. And if someone, you know, put it in your brain that, like, okay, say one of my patients was to have a stroke, what is the first thing I would do? You know, if you feel confident in responding to those situations, then I would feel that, you know, you could maybe work in a more critical care area. Maybe you could work in Emerge when you first start as a nursing student, graduating, going into preceptorship and working as a new grad RN. There are some people that work in the emergency, but again, it's depending on your confidence level working in different areas. Some people work in subacute, where it's a little bit more stress-free in terms of patient adverse events, just because they have more chronic comorbidities, and we're working on providing them treatment from a chronic perspective. So subacute units are, you know, just less acute and less chance of adverse reactions happening, adverse life events happening, I should say. So it really depends on, to answer that question, it really depends on your confidence level. If you feel confident in being able to respond to adverse events that occur in a hospital setting, in a patient setting, let's say it's like a heart attack, say it's a stroke, say it's like high blood sugar, if you know exactly what to do in those situations, then I would say you could work in a more critical care area. Personally, I was not ready, so I worked in an acute medical floor for a few years. Then I went to a cardiac floor, and then I applied for the specialty program in emergency, just because I wanted more confidence in being able to perform a lot of my clinical skills. So that's how I would answer that question. So let's move on to the next question. And the next question is, this next question talks about working overtime and taxes, especially related to Canada. Now, I'm not sure how it works in the States, but I can say that in Canada, there's a common myth amongst nurses that the more overtime you work, the more taxes you're gonna have to pay. And what I would say to that is, yes, you have to pay tax, but any income that you get, you're gonna pay taxes on. Like, there's no way for you to get around that. So it's always better to work more overtime and increase your income than to not work and not make money. Like, people think that if you work a lot of overtime, you're just gonna pay a lot more taxes and it's not worth it. And that is, I cannot stress enough how inaccurate that is. I actually have uploaded a video, which is I think coming next week or 2 weeks from now, talking specifically about this. And it's the feeling that if you work more overtime, somehow you're gonna move up a tax bracket and then you're gonna get taxed a lot more, then all of a sudden you're making a lot less. That's not true. So there's actually, if you research this, there's income brackets from a federal level. So you pay federal income tax, and then there's a provincial income tax. So depending on the province you live in, you will get taxed accordingly, a certain percentage if your income falls in between certain level. All right, so for example, let's say that your income was $75,000. So as you can see here, these are theoretical numbers. These are not actual numbers. So if you made $50,000 to $70,000, that amount above $50,000, you would get taxed 5%. So say you made 75, you're obviously gonna get taxed 5% on the $20,000 that you would have made. But then once you go into a higher tax bracket, so say $70,000 to $90,000, you get taxed 10%. And say your income was $75,000, that means that for $5,000, you would get taxed 10%. So essentially what that means is, as you should aim to work or make as much as possible, because then you would, you will still have to pay those taxes regardless of whether it's overtime or not. So what I'm essentially trying to say is, yes, over time you will pay more taxes, but that's because your income is going up. It's not because you're working overtime and it's quoted as overtime. There is no additional tax based on the type of work you do, whether it's regular time or overtime. This I know for sure is true in British Columbia. However, I'm not sure if you work in a different province, if it's different, or if you live in the United States, if it's different that way. I'm not sure of that. So all I can say is for sure, I know in British Columbia, they don't have that. I'm not sure in other provinces or in the US if it's like that or not. So the next question I got asked was talking about personality types and specialties in nursing. And it's really hard to answer that question because, you have your personality and it may work in different floors and different specialties, but there is a type of personality that I think would thrive better in different environments. So for instance, if you were somebody that gets, if you get stressed out easily, or if you get overwhelmed easily, I wouldn't recommend working in emergency because there's always so much to do in emergency. If you're really struggling with the theory of nursing, I would not recommend working in emergency or working in critical care such as the ICU, CV-ICU, because all of these areas require a lot of theory knowledge that you need to apply in the clinical setting to understand what's going on with each patient. And so not knowing theory is just going to be really detrimental and unsafe for your practice. There's, there's a lot of people that like routine and just showing up for work and doing the same tasks every single time. And for that, I would recommend maybe working in, post-op, or, working in areas where they go into the operating room or OR. A lot of those, jobs are very, I shouldn't generalize here, but I'm just saying those types of jobs, they seem to have a certain tasks that needs to happen with each patient, and it's just about meeting those tasks within a certain time frame. So it becomes very routine in your every day-to-day life. Now, if you're wanting more calm and being able to spend time with the patient, I would recommend working home health. Now, obviously, home health, there are different sectors of home health which are going to be way more busier than others, but home health, you tend to have more time to speak with the patient and answer certain questions they may have. And home health is really, I think, the best way to get to know your patient. But I would say in general, like, it's so hard to answer that question because there are so many different types of specialties that you could choose from. Like, you could be a insurance nurse, you could be a nurse entrepreneur, you could be a nephrology nurse, you could be an OR nurse, you could be a cardiac nurse, you could be a medical floor nurse, you could be a medical ICU nurse. There's so many nurses out there within different specialties. Like, there's informatic nurses, or forensic nurses, which, as you can see, there's just so many specialties. But what I would emphasize is that if you feel that you get stressed and overwhelmed, don't go work in an area where it's stressful and overwhelming, like the emergency or ICU. There's definitely certain areas that have a different pace of work, and I would recommend to identify what you enjoy doing, because ultimately, me working in emergency, it may be cool to say that you work in emergency, or work in ICU, but if you don't actually enjoy it, you're gonna burn out. And that's what happens to a lot of nurses, is they like the sound of something, but whenever they go and actually do it, and when they're there, they're not interested in learning about it and learning more. Like, for instance, during my spare time, what I try and do is to learn more about the theory of critical care patients and medications and all these different things. I try and learn so that I can practice more safer and try and provide better care. And that's because I'm passionate about it. But if you're not truly passionate, you won't take that extra time to learn more about certain conditions, and ultimately you could burn out much easier than somebody else that is a lot more passionate. And recently I did upload my work schedule, and as you can see, like, I work a lot, and it's not because I want to make like tons and tons of money. It's just because, I like what I do. And so when I go to work, as cheesy as this sounds, I actually enjoy it. So learning about different patient conditions and situations is really interesting to me. So, working in an area that I truly love, I'm able to, learn a lot more and enjoy it. And it works for my personality. And then lastly, I want to talk about an update about this channel. So I recently did a poll, as you can see right here. And the poll, I was asking what are my viewers wanting to see? I wanted to know the demographic of my viewership so that I'm able to provide more content that's focused on what they want to watch. And a lot of you answered that you're international nurses or that you're nursing students. So what I'm going to try and emphasize doing is I'm going to create a lot of basic theory content and put it out using this whiteboard that I recently purchased. I'm going to try and explain things in a much simpler way in order to help nursing students out there, and also maybe create more advice or tips for people wanting to immigrate to Canada. And obviously, like, the immigration to Canada aspect, I can't say that I can give you great insight on that because, I was basically raised here and I don't know how that process works. But what I will do is I'll try and learn about learn more about some of the process, or maybe I might find somebody that has immigrated and do like an interview with them. So that's where my channel is going. And as for, I guess I could give you guys a bit of an update for my career as well. My career, unfortunately, I applied to nurse practitioning school, to UBC's nurse practitioner school, and I did not get accepted. In fact, I didn't even get an interview to their school. Now, to provide more context, they require 2 years of nursing experience, and because I don't really know if I met that criteria, I don't think my application was actually processed. And then also there's the issue that because I did my emergency nursing specialty and the hospital paid for my school, if I actually did get accepted, I didn't actually know if it would be worth it for me to quit my job, because I have to commit 18 months to working at that hospital, because they paid for my tuition and paid me full-time salary to work in emergency for 18 months. That would mean that I would have to cut the contract and I would pay a huge fee. And according to when I signed the contract, my education costed approximately $40,000. So I would assume that the fee is going to be roughly around like $20,000 to $40,000. And I didn't know if that was something that I truly would do if I were to get accepted to nurse practitioning. However, I am not upset by this. I mean, I think there's a lot of opportunities out there as a nurse that I can pursue, and I applied to one school once and didn't get accepted, and that's, to me, it doesn't make me feel bad, because that was just 1 year I applied and one school I applied. I think in the future, you know, next year or the year after that, I'm really going to focus on working in the States, figuring out how I can move to the United States and into the state that I truly want to work in, and then maybe do a master's program in the United States of America rather than do a NP program in Canada. So that's kind of where I'm aiming to go with my career. And throughout all these years, of course, I'm going to be continuing to upload videos and giving you guys updates on where everything goes. And I am, as many of you know, expecting a baby anytime now. It should come like pretty much right now, if not soon. So that's an update with my career and what's going on behind the scenes. And that's what you can expect for in this channel coming up. Thank you so much for watching this video. I hope it was helpful for you, and thank you so much for supporting me and this YouTube channel. If you got any more questions, I'll try my best to answer them. Leave them down below, and I'll catch you in the next video.